Right, next we're going to get into some of the interventions that you may have actually experienced or maybe coming up in the future. So starting off with angioplasties or stents. So coronary angioplasty is a procedure to open up the blood vessels in your heart to increase the blood flow and allow all that oxygen and nutrients. It can be done after a heart attack if necessary, or some sort of angina or chest pain attack. Sometimes it's found before any of these symptoms arise, and it's done more as a preventative measure. So during an angioplasty, the catheter or a small tube is inserted either into your groin, your arm or your wrist. It is then guided up to the heart itself and inserted into one or more coronary arteries where the tube will go in, and so it goes in thinly into the blocked or clogged blood vessel, and they'll expand it out. When they expand it out, they actually leave the stent, which is kind of like scaffolding, out to keep that artery open for the long period of time, so it's not open and then it's going to come back closed again. They'll open it, they leave the stent in place so that it stays open, allows all that blood flow to come through the middle of it. There are two types of stents, so you've got the bare metal stent as one, or the drug-eluting stent. So BMS or a DES for short in the acronyms. If you see that in your discharge paperwork, you have a bit more of an understanding about what's actually happened. So coronary angioplasty is not a cure for coronary artery disease. It only treats, or probably more appropriate, it manages the part of the coronary artery that has become narrow. That doesn't mean there are not other sections where you're starting to get this atherosclerosis, that it's slowly starting to clog up. It's just those parts where it got really bad and may have been causing symptoms. They've gone in and popped the scaffolding in to try and increase the blood flow so that you don't have angina or a heart attack.